Thank you, Governor, and good afternoon to everyone. Let us begin with the numbers. So today, we are talking about total cases at 5,878, and our hospitalizations are a little bit above 1,750. Unfortunately, we have now seen 231 deaths in the state of Ohio from COVID-19. Next slide, please. A couple things I'd like to point out. We do know that we have tested about 58,000 in Ohio. We still have about 84 counties reporting at least one case. Our ICU admissions are still in the 9% range. Our hospitalizations right now are 30% of our cases because we know we're testing the sickest. Next slide. This is a new slide that we have on our website. Again, really trying to be as transparent as we can be and share with you the data as we have it. This was the dashboard I showed yesterday that's tracking a 5-day case average so we can start to see trends. Any one day we might see a slight fluctuation, but the data we're really concerned with here is starting to watch the trends. We know we're sort of flattening, and that flattening is by and large staying even. It might be flat for a long time, not a sharp peak to this. But what we really are looking forward to seeing is those numbers going down. And this gives you sort of a 5-day trend. Next slide. This slide actually shows hospitalizations, a little bit of detailed data. The mean age at hospitalization is 64, but as you can see here, on the age range from as young as under 19 and then going up by decade, you can see it's a bit skewed. So we are seeing people younger in the 40s, 30s, 20s, and a few that are in the 0 to 19 age that are hospitalized. We are in our data overall of cases seeing slightly more females, but something we've seen around the country that hospitalizations, in this case 56%, are male. So it is for various reasons that the science is still trying to elucidate, seeming to be worse scenario for males. Next slide. Does it forward? No more slides than that? Okay. So we have this in all data on our website. As the governor mentioned, we're starting a new dashboard that actually has the new CDC case definition in it. Just by way of background, case definitions by the CDC, which guide how states count cases, has been evolving since the beginning of this disease. It began very early on with a case being called someone who had traveled from Wuhan province. And then it expanded gradually to all of China, and then it expanded to additional countries, and then it expanded to the United States. So that definition continues to evolve with the understanding of this disease. But very importantly, the subtle changes that have occurred, as the governor said, are talking about expanded confirmed case definitions. So in the past, a confirmed case was from a test. That test being a special kind of test called a PCR test. That's the test that we've been talking about for the most part all along. Now there are some new testing technologies available. We still don't have them in any significant amount in Ohio. One is a rapid genetic test called the ID Now. That's an Abbott test or a few other brands. Those can do a rapid 2-hour, but it's still more like those PCR tests. Pretty soon, as the governor said, the test I'm waiting for are the antibody and antigen tests that are prick of the finger versus anyone who's had this test knows what I'm talking about, or a flu test, the swab that you actually have go down your nose. And it's people who've had it know that that is not fun. Having a quick test that you can do blood on will help us rapidly diagnose people both with the disease and an antigen, and also people who have recovered from the disease. All of that data is so essential for us figuring out who now is no longer susceptible but is actually recovered. And as we know, we are all susceptible because this is a novel virus. So that new definition will be including the new types of testing that are now available, though I can tell you that is not really widely available in Ohio yet. What that did for us is change our case definition yesterday by about 17 cases. So it's still not a lot of numbers, but we want to be really clear with folks where we're getting our numbers as we move forward. And it also allows the diagnosis of cases in epidemiologic and clinical conditions. What that means is, for instance, in a nursing home, where we have very few tests available, once you've tested a couple of the nursing home residents, and they clearly, in the old PCR test, have COVID-19, we can pretty much guarantee that every other case, if they're flu negative and no other respiratory disease, are basically a spread of that disease. So those very detailed clinical cases that have a tie to a very clear person who tested positive as their exposure is also counted. So we see the tip of the iceberg right now. We have to be very clear and transparent with you. All of these numbers are a gross underestimation of the amount of disease out there. Again, most people are mildly symptomatic. 25%, up to 25% may be asymptomatic or carrying it, and we have no way of knowing that they're doing that, and we're not really testing those folks with our very limited tests. So we know all these numbers are still the tip of the iceberg. We're seeing a little bit more of the tip of the iceberg with this new definition, but until we have full and available testing, we really won't know. The most important thing for us right now is to continue to follow trends, and that's why we share that data as well. And we'll keep sharing more as we know more. A couple other things I need to address. Essential and non-essential surgeries. This dates us a while back, but if you remember, we've limited the non-essential surgeries in Ohio, both to free up capacity in our hospitals, but also because we have a severe shortage of the protective gear. So we're trying to use that for the surgeries that have to occur. Now, we've heard, the governor, lieutenant governor, I've all heard some anecdotal stories that sometimes there's confusion about what's essential and non-essential. This is very, very important. So I want you to hear this, both you at home as a patient who might need a surgery, and I want all our clinicians and doctors to hear this as well. It's really important that we know that here are the 4 criteria. It has to be a non-essential, and essential is based on a threat to a patient's life. If the surgery is not performed, that's one criteria. Threat of permanent dysfunction of an extremity or organ if the surgery was not performed. The risk of progression or worsening condition or disease, that's very important, or a risk of rapidly evolving symptoms. For you at home, and doctors, really, really make that clinical diagnosis and stay close to your patient. If they are in extreme pain from something they're experiencing, that changes the clinical condition. If you at home are having symptoms that are worsening, or if you are unsure about this, contact your doctor. And if you are still not sure after what you've heard, I want you to call the emergency room. I want you to go to the emergency room. You should not be having unremitting pain or change in your symptoms and just accept that diagnosis. So please take this seriously, doctors. If it's worsening, this is the difference. On an easy case, it's a melanoma that's spreading. Of course, that's essential. Cosmetic surgery is not essential, but there is a wide range in between there. And if somebody has extreme pain or worsening conditions, we need to reevaluate that patient. So let's look again, everyone, at essential and non-essential surgeries. Next, I'd like to show you a video. This is a video that's airing around our state, and what it does is show the difference in sort of a different way to help you understand about how we're slowing the spread of infection. This is all about something that scientists call the R0, or it's the number of reproduction. It goes back to what I told you about that exponential spread of disease. When we started this out, the R0 that is scientifically known, the spread of disease, is that one person quickly, in the span of 3 to 6 days, can infect 2 to 3 more people. So let's take a look at this video. So you'll probably want to watch that video again. The first time I saw it, I have to admit, it took me a second to understand. But it really has to do with that little bit of social distancing, the fact that we still are making all the difference in this. It's when we don't spread it to someone else, and that spread is often to 3 more someone else's. And there's a wonderful article about this in the Columbus Dispatch today. I really recommend people reading it. It's more about this reproduction number. So this R0 is what happens when there's a new virus and all of us are susceptible. And R0 takes into account how contagious a virus is. Well, we all know now that this virus is very, very contagious, much more contagious than the flu. How many susceptible people there are. In the beginning, all of us were susceptible. And over the course of time, more and more of us will catch it, more and more of us will recover. And we will go from someone who's infected, so susceptible, infected, or recovered. And it also has to do in this number of what we do to stop that spread. So the R0 for this was at first told to be 2.3. You want an R0, whenever an R0 or that spread number is above 1, it means that we're exponentially growing it. When you have an R0 of 2, it means that at first you have 100 people infected, but in 3 days you might have 200 people infected, and 3 days later you now have 400, and that goes on exponentially. But when that R0 is less than 1, that is actually happening in the reverse. You might have 100 people, but now they only spread it to 50 more instead of 200. And then the next doubling, they only spread it to 25 more. So that exponential goes in the opposite direction. And that's when we start to see a disease burn out or really not, we break those chains of transmission. So the things that we have seen over the last 2 weeks, because of that spread, because that ping pong ball is not snapping off and spreading it to others, means that we have lowered that R0 as a guess, and this is an underestimate based on the amount we can test, to 1.21. We know those R0s are underestimates, but still, it shows that you in Ohio are slowing that spread. And the more and more we can do that, the more and more we can stop that rapid spread of disease. Finally, I want to say one last thing. This is a very special time of the year, and the holiday and the symbolism are not lost. I think it's very important to know we are sharing some great news, the great news in Ohio of what we have done to stop the spread of this disease and slow it down. But there's a very good David Brooks column. He's one of my favorite columnists. And he called it the pandemic of fear and agony. I think it's really important that we talk about what is optimistic and look to what is good. But I never want to deny for you, the honesty about the fear and the pain many of us are going through, from losses of jobs to things. And he said in his column, this is about our bravery, and I'm telling you this weekend always at this holiday makes me think about it, and the vulnerability, and that we're still being brave in the face of things that make us afraid and anxious and vulnerable. So David Brooks said, I am reminded that this is a time to practice aggressive friendship with each other, to be the one who seeks out the lonely and the troubled. It is also true that character is formed in times like these. People see deeper into themselves. They bravely learn what their pain is teaching them, and they become wiser, they become softer as a result. So this is a very disruptive thing. A pandemic is not just disruptive in terms of deaths, it's disruptive in so many ways on a society. And I want you to continue to be vulnerable, and I know you're all being very brave. Keep reaching out to each other. Thank you.